And we are live.
Ted and technology team, thank you. Lieutenant Governor, I think we're ready on our end whenever you're prepared to open the meeting and introduction. So thank you all for joining us this morning. Hi, Lieutenant Governor, we're unable to hear you. Are others able to hear?
Kelly, is this a problem people aren't hearing? I see Sean shaking his head no, but I can hear you as a guest.
I know. Can individuals hear me speak? Can you give me a thumbs up or?
There we go.
Okay, so it seems isolated to Lieutenant Governor. Ted, do you have any support ideas?
I will call their office. I really don't know. We could have the Lieutenant Governor call in via the phone number available. Do you have that, Kelly?
It's my there.
There we go. Thank you.
Okay.
Sorry, everyone. I apologize. I actually trying to get on my computer, but for some reason it wasn't working. So I apologize for that. I will open the IDD Task Force Meeting of January 29, 2024. I will go ahead and read the members, and if you can indicate your presence by saying aye, we will go ahead and start the meeting. So Kelly Mitchell with DERS.
Here.
All right. Flora Steinmetz with OMPP. Jay Chaudhry with Division of Mental Health and Addiction. Catherine Barrow, the Governor's Council for People with Disabilities.
Present.
Nancy Holsapo, the Department of Education.
Aye.
Jan Kulik for Indiana State Department of Health.
Aye.
Sorry, Jan. Leslie Huckleberry, Division of Agency. Eric Miller, Department of Child Services. Kim Dotson, the Arc of Indiana.
Present.
Kay Stafford Cunningham, NR.
Present.
Joe Langarek, Jackson Kelly, PLLC. Sean Fulton, Arc of Indiana.
Present.
Daniel Mize, Self Advocates of Indiana.
Present.
Jason Meyer, Passages.
Present.
Pat Cochran, CEO, Sycamore Services.
Present.
Suzanne Crouch, Lieutenant Governor's President. Senator Michael Hodchek, Senate Republican. Senator Shelley Yoder, Senate Democrat. Representative Ed Clear, House Republican.
Present.
And Representative Chris Campbell, House Democrat. With that, the purpose of this meeting is to provide an update to task force members of the proposed changes by FSSA, and then to allow task force members to ask questions. It is being live streamed. The public can access this meeting, but will not be able to participate. And so with that, Kelly, how long do you need for your remarks?
It should take, I would say, around 35 minutes to
Okay,
get
let's
through the deck.
Yeah, let's make it as brief as possible.
Okay, absolutely. Thank you. Thank you, Lieutenant Governor. So good morning. Again, I'm Kelly Mitchell. I'm the Director for the Division of Disability and Rehabilitative Services. And I also have with me today Kathy Robinson, Associate Director for the division. As the Lieutenant Governor said, we're here to share some information with you today and updates regarding the Medicaid forecast and FSSA's home and community-based services waivers. Before I begin, I do want to recognize that we are receiving a lot of calls and emails seeking clarification and or to provide comment on the proposed waiver amendments. As the waivers are currently out for public comment, we do want to ensure that we appropriately capture that comment and recognize trends in that feedback. We also want to ensure that we're being very clear and consistent in our communication. So we are not individually responding to the emails and calls, and we are utilizing the FSSA webpage, which I'll provide that address at the end of this presentation. But we're using that to provide updates and clarifications that include an FAQ that's based upon a lot of the feedback and inquiries that we're receiving. I would also like to take this time just to encourage that individuals and families who are seeking guidance about their particular situation or case to connect with their case manager or their care managers for those questions, just to ensure that it's a very person-centered approach and that it addresses your specific needs, because we're in communication with those case managers and care managers. Hold on. So the information that I'll be covering today is going to provide a general overview of the Medicaid forecast with some additional information related to that forecast. I'm also going to share some details regarding the waiver transition overview and elements that ultimately that were impacted by the forecast. And we want to advise everyone of the current waiver drafts and then the public comment activity that is currently underway. And Lieutenant Governor, as you stated, then we'll open it up for some questions from the members of the task force. So first, as many of you know, we were on a path to implement waiver integration and amendments to support that integration when the December Medicaid forecast highlighted sustainability issues. And as a result, we paused as we worked to understand what was driving the forecast as we planned for our future state. As was noted in FSSA's presentation to the State Budget Committee, the state team identified a potential $900 million variation from the April 2023 Medicaid projections. The FSSA team worked really hard and continues to do this in reviewing data, policies, approved waivers, and current waiver drafts so that we might better understand the drivers behind the variance. We did this and continue to do this in order to truly understand the issues so that we might design approaches that are as tailored as possible. And we have worked to maintain our focus on all the people we serve and sustaining the forward momentum on existing agency initiatives that have been developed through stakeholder engagement. Those include, but are not limited to, a focus on designing an array of waivers with a holistic range of services to better support the needs of Hoosiers with disabilities, a pathway to support Hoosiers in their homes and communities as they age, and a focus on attracting and retaining a quality direct service workforce to meet the needs of those we serve. Sorry, I'm multitasking here. So as we began that review, the items that are summarized here on this slide were identified as primary drivers of the forecast variance. Some of these drivers are beyond our control, but obviously they're changes that we have to respond to. Those would be a decrease in our federal FMAP. That is the federal match that's provided to us for Medicaid. So what that decrease obviously has an impact on the variation, and we don't have control over that. I think what we would like to point out is that ultimately that decreased FMAP is a positive for the state of Indiana, as it is indicative of an improved fiscal position. Also, one of the drivers beyond our control were pharmacy rebates. Those were less than what we had anticipated. Again, while it impacted Medicaid, it is also of note that this was a good thing for consumers, since our less than anticipated gains in pharmacy rebates is because costs for medications like insulin went down substantially. And another driver that is beyond our control is Medicare Part D clawback. This occurs when we reconcile with the federal government as it relates to those that are dually enrolled, Medicare and Medicaid. And what occurred is that the cost to buy into Medicare increased. Some of the other drivers that were identified was the delayed implementation of the new ABA rates. We had originally planned to implement those rates in October of 2023. And as most of you know, those rates went into effect January 1, so there was a delay. And then additionally, there was an unanticipated growth in enrollment and utilization of home and community-based services, but particularly within the A&D waiver, or the aged and disabled waiver. In the review of that data, specifically the growth within the aged and disabled waiver appeared in attendant care, and a significant driver of the variance within attendant care is increased enrollment and utilization, particularly since 2020, with a significant increase in children. Let me move to the next slide. What you see on the screen now are some graphs to give you a visual of some of the data that we pulled as it related to expenditures and utilization on the aged and disabled waiver. I will be, by the way, I don't think I noted this, sharing this slide deck with the members of the 1102 task force following this presentation. I know sometimes these charts are hard to read up on the slide. But as you look at this particular slide, what you will note is that there has been a significant increase in enrollment since July of 2023. Particularly if you note the difference between the first month when there were about $20 million in expenditures, and this starts back in July of 2020, excuse me, and the last month here, where expenditures are about $120 million. I would also like to emphasize that while we see a very specific and substantive trend relative to the pediatric population, which is highlighted in the chart on the right side. So this is specific to children 0 to 18 years of age. When you look at the blue line, this is the enrollment number. So number of individuals accessing on both charts. And then of course the bar charts are the expenditures. But the pediatric population is not the only driver responsible for the increased utilization. And I would also note that on enrollment, when I mention unexpected or unanticipated growth in enrollment, that relates more to the pediatric population versus the aging population, which was more anticipated in our projections. This next slide takes the bar charts that were just referenced on the previous slide, and it accounts for the increase in reimbursement rates. We have had a lot of questions as to the impact of the rate increase that went into effect on July 1 of 2023. This chart demonstrates the increase in cost in order to recognize the rate increase. The green bar, the green portion of the bar, shows the growth in cost based on pre-July 1 or pre-rate increase reimbursement rates. So again, as you would look in January of 2022, note expenditures in this period of time were just around that $20 million mark. And then as you follow that through December of 2023, the green would be normalized to reflect rates prior to the increase. You can see that that moves nearly or is right at the $80 million mark. The gray bar then reflects the cost with the rate increase. So therefore, this allows you to see the impact of what was rate increase and then what was increased enrollment and utilization. So you can see that continued trend upward. Sorry, I'm a little slow. And looking at the forecast variance, about half appears to be driven by LTSS or long-term services and support. Of the strategies that I'm going to discuss with you today, we anticipate about a $300 million impact. As a result, we do continue to seek opportunities to address the remaining projected shortfall. Upon identifying the drivers that I just reviewed with you, our goal was obviously to mitigate costs that had already been incurred, to change the trend, and to review policy and procedure to improve monitoring and forecasting to ensure sustainability of the Medicaid system, while ensuring a continued focus on priorities and a focus on the individuals we serve. In considering our key approaches, we were looking to implement strategies that minimize the overall impact to recipients and a focus on strategies that actually address the specific drivers of the forecast. We've identified two broad categories that are noted here on the slide that you're viewing to minimize the impact of the projected forecast. And I'll talk a little bit about those next. So we have evaluated first in minimizing the impact, the costs that have been incurred. We've evaluated our home and community-based enhanced FMAP. For those of you that aren't familiar with that terminology, those are additional federal funds that the state received that were made available as a result of the COVID-19 pandemic, the public health emergency. So upon evaluating those, we have reallocated some of these funds where they can be appropriately used per the terms that are defined by CMS as allowable usage to contribute in assisting and positively impacting the projected shortfall. We've also put a pause on the 2% rate indexing planned approach that was approved by the legislature in the last session and presented in the waiver amendments that were most recently out for public comment this past November and December. On the 2%, I would like to share with you just a couple of items of note. The legislature did memorialize the rate matrix and statute, but that included only the every 4-year rate methodology review, not the indexing. And while the budget request contemplated doing 1 year of rate indexing, any resources devoted for that effort were needed to fully implement the initial rate increase. As you know, we've shared with you, the utilization was significantly higher than we had anticipated. So in the updated waiver drafts, we've changed the 2% to permissive language so that if and when circumstances are such that an index can be implemented, we can avoid having to go through the waiver amendment process again. So now let's review the strategies that are focused on impacting the trend in Medicaid spending. I have them listed here. So we're ensuring service definition compliance, looking at pediatric eligibility, pausing expedited waiver eligibility, ending the practice of retroactive Medicaid eligibility, maintaining our current level of waiver slots, putting in place a process for review of service plans and reduction of auto approval, and then looking at the structured family caregiving provision for legally responsible individuals. I want to talk a little bit about adjusting which service plans on the age and disabled waiver are auto approved and which service plans will be reviewed by state staff. This review process will focus on service teams' appropriate application of person-centered planning and assessing appropriate service utilization according to the CMS approved waiver definitions and allowable practices in service planning requirements. Based on our data and existing service definitions in particular, we plan to look closely at attendant care, home and community assistance, structured family care, caregiver coaching, and community transition. A state team will be identified to review those service plans and establish processes to ensure uniformity and consistency in the reviews. Our target implementation date is mid-February 2024, and no change to our waiver is needed for this administrative approach. One of the other areas that we're targeting involves steps and practices that we can employ to more fully ensure service definition compliance. FSSA will be reinforcing practices to ensure that all services are approved and delivered in a manner that's consistent with the federally approved service definitions for those services. So care managers and providers will be trained on home and community assistance requirements. And in the next waiver amendment currently slated for 2025, FSSA plans to clarify service definitions of home and community assistance and attendant care. Our team will develop and administer an aligned training across FSSA divisions to ensure that requests are reviewed with greater uniformity for specialized medical equipment, home modifications, and vehicle modifications. And again, our targeted implementation of these particular strategies is set to occur from the mid to end of February 2024. Finally, I'm going to touch upon the legally responsible individuals, attendant care compliance, and structured family caregiving. It's important to note that the currently approved aged and disabled waiver does not allow for legally responsible individuals to provide attendant care. So FSSA will ensure practices reflect the CMS approved aged and disabled waiver in regards to legally responsible individuals. And we'll talk more about the definition of that, and providing paid services, and in particular, attendant care. We want to create a sustainable path for parents and spouses to support the waiver member. And going forward, our plan is that will be via structured family caregiving and not via attendant care. Structured family caregiving takes into account the unique nature of receiving support through a living caregiver. It emphasizes maximizing the member's abilities and independence, as well as supporting the caregiver through training and support. And as a result, the service requirements include regular home visits from a caregiver coach and or nurse, along with respite care. This is all delivered through a daily reimbursement rate that allows for fluid movement between daily life and care needs. And as a result, this model of care is ideally suited to supporting LRIs, legally responsible adults, who are being paid to provide care to their loved one. Allowing an LRI to provide structured family caregiving recognizes the important role of key family members in caregiving, while ensuring appropriate support and protections exist. As an example, as I stated, that structured family caregiving service requires providers to provide respite for the LRI caregiver. This service also requires service provider backup for the primary caregiver in the event of an emergency. So a lot of you have asked, how are we going to move forward to make this change? So we will be supporting our care managers, providers, and members to ensure compliance with the LRI requirements through notification process and reviewing service plans. First of note is that no new LRIs effective January the 17th should begin providing attendant care services. We're currently putting system edits in to ensure compliance with this. And there will be more communication and bulletins from FSSA with more details regarding that. Members who currently have an LRI prior to that 1/17 date, providing attendant care now will have several options. For example, they can transition to structured family caregiving if they want an LRI to continue to support them. They may also choose to have another non-LRI legally responsible individual attendant provide care. LRIs who are spouses will be able to make this transition now. And we're creating a process for parents and children via a waiver amendment. But in the interim, parents will be able to continue to provide attendant care until that structured family caregiving by a legally responsible individual is authorized by CMS. We recognize, though, those families will need support from their care manager and service teams today and going forward in thinking about the considerations and planning for that transition. So it's important to note that even though individuals can continue, those that are currently providing attendant care as an LRI prior to January 17th can continue to provide through June 30th. Members will continue to have regular service plan reviews, and plans are eligible for changes just as they normally will be. So changes to our draft waivers will be reflected in the drafts that are posted. You'll see those. And then we'll be working to implement those changes internally. I just want to highlight, I referenced this earlier, who is a legally responsible individual. So as defined by CMS, an LRI is the parent of a minor child, a legal guardian of a minor child, or a spouse of a Medicaid waiver recipient. As I noted, CMS restricts the ability of an LRI to deliver personal care services. And part of this is because it is very difficult to differentiate the typical responsibility of an LRI from those services that are rendered through attendant care. It's also important to note, as we think about supporting individuals with disabilities, that attendant care and home and community-based service waivers are not the only avenue of services and supports. For minors, there's access to an array of services, including entitlements, educational services through the Department of Education, through state plan. There's what is called EPSDT, early periodic screening, diagnostic, and treatment. I hope I got that right. First steps services for children birth to 3. There continues to be traditional Medicaid, other services and supports that are available through the waiver. And for certain children, there's some wraparound services through mental health. Adults also have access to an array of services beyond attendant care through home and community-based waivers, traditional Medicaid, and in some instances, access through community mental health centers and mental health services. So as we look at this, one of the things that we are trying to share with folks is what is attendant care and what is not. Attendant care, it should be noted, is not skilled care. Attendant care, as defined, does not provide compensation for skilled care. However, many members may be eligible for a state plan home health benefit, which can support skilled care needs. This is not a waiver service, but is funded through traditional Medicaid. So attendant care is focused on personal care assistance, things like bathing, oral hygiene, hand and foot care, intact skin care. Why does that say that? Wound care, open wound care would be considered skilled care and needing that level of service. Mobility assistance, assistance with toileting of note, which would exceed assistance that would be required for an individual at that stage of their development. It could be assistance with nutrition, meal preparation, health and safety and household tasks, and transportation to non-medical community activities that would be beyond what assistance would typically be required again for an individual at that particular developmental stage. So as you see, some of these tasks, it can be difficult to say, where does the role of the LRI end and when does it become attendant care? And it gets a little bit cumbersome as, let's just say, a parent of a child would have to clock out to give medication. A parent of a child would have to clock out of attendant care if providing support, say, for a catheter or a trach or other healthcare needs. Those services are not within the service definition of attendant care. Those would be considered skilled care. So why, you ask, structured family caregiving? So I've listed again some of the things that are supported through structured family caregiving. This provides a pathway for LRIs, those legally responsible individuals, to continue to provide paid support. It recognizes the typical relationship between a parent and a child or a spouse and partner, and it provides for the flexibility in supporting a child throughout the day or the partner. There's a built-in respite requirement. It also includes nursing and caregiver coaching as part of the model. And structured family caregiving can be coupled with other services and funding sources. So again, if there's a need for skilled care, many waiver recipients may qualify for state plan home health benefits. And we're not referring to a waiver service, but a traditional Medicaid service, and may qualify for other services and support through the home and community-based service waiver. We'd also like to note that structured family caregiving is reimbursed at a daily rate, a per diem per member. And that is divided into 3 levels of care. And those levels of care are based on this individual's level of need. So
Excuse
there
me,
is-
Kelly. Excuse me,
Yes.
Kelly. I hate to interrupt, but can you wrap this up in the next 5 minutes? Because I want to leave time for task
Yep.
force members to
I'm-
be able to ask questions.
Yep, I'm nearly there. I'll rush. So there are 3 levels. Level 1 is paid at $77.54 per day. Level 2 is paid at $99.71 per day, and level 3 is paid at $133.44 per day. It's also important to note that we are reviewing internal processes for provider certification to enroll as a provider of structured family caregiving. So I just want to touch real quickly. Our current proposed amendments and planned future amendments will continue to support our waiver redesign and reset efforts. So we have not stalled on that journey. We continue to take a holistic approach with waiver redesign, knowing that many of the areas of priorities that have been identified through stakeholder feedback, such as those listed above, are important in setting our trajectory. We're going to continue to focus on those priorities as they're core to the broad enhancement of services and supports for all of the waivers within our Bureau and division. And we'll be supporting post-waiver transition regardless of those services and how they're funded. Having said all that, we'll continue our ongoing efforts to further connect with stakeholders, inclusive of individuals and families currently being supported through the aged and disabled waiver and traumatic brain injury waiver, to learn more about their needs, desired outcomes, and how they want to be supported. So this is a unique opportunity to align home and community-based services and identify common threads that ring true for all. This is just a highlight of where we're at now. This is a highlight of where we are moving. Once the integration occurs, I just want to note that those 4 waivers will be coming under the umbrella of the Division of Disability and Rehabilitative Services, July 1. So, and I want to note what is out for current public comment: the Family Supports Waiver, the Community Integration and HAB Waiver, the Traumatic Brain Injury Waiver, the Health and Wellness Waiver, formerly known as the Aged and Disabled Waiver for those that are under the age of 60, and the Pathways 1915B and C waivers, which includes those served by the Aged and Disabled Waiver that are age 60 and over. And now there is Hoosier Care Connect waiver that is out for public comment. The next slides are just a highlight of, and I'm not going to read these to you, of what is included in those draft waiver amendments. It recognizes what is new in this most recent public comment period and what was shared during the previous comment period, November to December. So you will have this as reference in your packets.
Thank you, Kelly.
And of note, I just want to note here the Hoosier Care, well, I don't know why I'm struggling with that one. The Hoosier Care Connect waiver amendment is new. It wasn't previously posted, but this was planned. And it changes the waiver target population to recognize and reflect that ages 59 and under. So that's the change there. I want to highlight that the public comment period is now open and it continues through February the 16th. Again, stressing that July 1 implementation date. So this is how one can submit public comment.
Thank you, Kelly. Thank you for that very thorough update. And of course, acknowledging and we appreciate their participation and make those comments available to all the members of the task force following this meeting. In addition to that, please feel free. Well, I'm sorry. I'm sorry. I lost my my microphone. Thank you, Kelly. And I just want people to know that we recognize there are a large group of people participating in the chat room, and we will be sure that your comments are shared with task force members. In addition to that, please feel free to contact me at scrouch@lg.in.gov. And so I would like, as chair, to make a couple of comments, ask a couple of questions, and then open it up to the other task force members. You had indicated that the cost started to escalate in July of 2023. And the, I guess, inaccurate information was to the tax committee project the revenues and expenditures for the 2020. I do not understand how FSSA can allow $1 billion misrepresentation in terms of the forecast for the budget. And that is unfathomable to me how that can happen. And had the General Assembly had that information available to them, they might have looked differently in terms of funding $1 billion for IEDC or $1 billion for vouchers or 500 million for READY. And so, or giving Medicaid reimbursements to providers that hadn't had them for many years. So I just find it, almost unconscionable that we're in this position where Hoosiers are being affected in a way that is threatening their lives and their families' lives and their livelihoods, quite honestly. So with that, a couple of questions that I have. Is there, and I met with a group of parents and their disabled children on Friday in Warsaw, and we're talking severely disabled children. And so my question is, if parents are not allowed to take care of their children in a manner that, allows them to be able to support themselves and their children, who are these workers out there that are going to be taking care of these children and stepping in and filling those needs? Because we know there's a shortage of pediatric nurses, we know there's a shortage of nurses, we know there's a shortage of workers. Who's going to fill in and take care of these people? That is these individuals. And then a second question is, if they have to be institutionalized because we do not have the help and we won't reimburse at the level we've been reimbursing, what institutions are available to take these children?
Thank you for the questions, Lieutenant Governor. I don't think anyone is proposing that we institutionalize children with disabilities. As I shared, we are designing a pathway for families to continue, for legally responsible individuals to continue to support their children through structured family caregiving. We've also had an intense focus on improving and increasing our ability to attract and retain a quality direct service workforce, which was part of the effort in establishing that rate methodology and review.
Are there, have there been abuses by providers that have driven up these costs, not by the parents necessarily, but by providers that you all have been able to document?
I can't speak to that specifically. I can tell you that we're just continuing to drill down into the data and, taking as much of a granular approach as we possibly can.
Okay. I have some other questions, but for the sake of time, I will open it up to other task force members and they may come back afterwards. So task force members, do you have any questions?
So this is Kim Dodson. I'll jump in while other people are trying to unmute, and I'll just ask just a couple of questions that I hope are brief. And then I have a lot more. Lieutenant Governor, if we possibly could, I don't think we're going to get through everybody's questions. could we commit to getting those questions to your office or to FSSA and try to get answers for the questions we're not able to ask today?
Absolutely.
Okay, thank you. First question, I think this is an easy one. Kelly, the rates that you talked about for structured family caregiving, were those the rates going directly to families or directly to the provider? Those the provider rates?
That's the provider rate.
All right. And then we've gotten lots and lots and lots of comments from families, specifically around the shortage of nurses and the skilled nurses. So many of them share that they are getting paid for personal care attendants because they cannot find a nurse to come into the home and provide care. Could you talk a little bit on how that's not supposed to happen, right? Is my understanding that there's another place that they can get paid for those nursing hours?
Kim, yes, you are correct. Attendant care, the definition of attendant care does not allow for the provision of skilled care or nursing care as you state. And that is typically more appropriately provided through home health or other skilled services.
Are the rates dramatically different that would cause a provider or someone to charge attendant care rather than home health care?
I can't speak to that just off the top of my head today. My apologies. I can follow up with you on that.
And I'll stop there, Lieutenant Governor, just because I know there's several people who have their hands up.
Lieutenant Governor, this is Ed Clear. May I go next? Lieutenant Governor Crouch, are you still with us?
All right. Yes, I'm sorry. I keep forgetting to hit my tab to speak.
There you
Go
are.
ahead. Go ahead.
Thank you. I have several questions. I'll try to be very brief. Appreciate the presentation. I appreciate the presentation, but I'm concerned about the lack of transparency. On the 18th of this month, I requested from FSSA a breakdown of all the numbers connected with the so-called sustainability measures. Specifically, I asked for the number of individuals impacted by each proposed measure and the expected cost savings, and I haven't received anything to date. Today's the 29th, so that's been 11 days ago. So I'm concerned about the transparency, and I'm concerned about a lot of things. One of them is we've talked about what will happen with existing families, but it was made clear to me when this was announced that there won't be any new families during this transition. So what happens to families that aren't already in the program and as a result eligible for the transition, but rather start needing services now? Well, I'll stop there so others can ask questions. I've got a few more if we have time, but again, I hope we can get an answer to our questions as Ms. Dodson suggested. But please start with those.
Yeah. Well, thank you, Representative Claire, for the feedback. I will note the question on the new legally responsible individuals, as noted. In this interim, there are other individuals, non-legally responsible individuals that can provide that support. There are other avenues for skilled care. And then we're creating, that pathway for structured family caregiving for July 1. I think someone else was going to ask a question.
You didn't answer my other question.
On data?
Yeah, regarding the transparency, I've been waiting for 11 days to get numbers. I mean, I would think that before FSSA decided to take these specific steps, there would have been numbers about how many individuals would be impacted and how much it would cost, how much it would save. So where is the data?
I can't personally speak to that. What I can tell you is that we're continuing to work to pull together information, to share it publicly, and to be as forthright and transparent as possible. And I will note your feedback. Thank
And
you.
I will just, apologies, I will just add some of the data that you see in today's presentation will also be more broadly available as we're able to get more detail around that. I think we've been trying to compile some information to help demonstrate or reflect to folks what we're seeing in the data, similar to the slides that Kelly just walked through that show the trend line for attendant care utilization, particularly in the this last quarter. And so that is something that, as Kelly mentioned, we'll continue to monitor. Part of the strategy to also adjust how we are doing plan reviews is in response to the question the Lieutenant Governor had earlier about whether or not we have detected fraud in any of these situations. I think part of the strategy for us from a quality assurance and compliance standpoint is also to evaluate that as we dig into plan reviews in a more granular approach than what we are doing today.
Present it clear. Is that good?
I'm sorry, can you repeat that, please?
Are you satisfied? Can we go on to someone else?
Well, I mean,
No,
I just, I find
satisfied.
it hard to believe that FSSA didn't have the data I've requested prior to announcing the so-called sustainability measures. So I'm disappointed that it hasn't been provided to me and it's not being provided to other members of the task force or members of the public. I think transparency is critical in everything we do, and especially when families, Hoosier families, are being impacted in this manner.
Thank you. We have 7 minutes left. Are there other people, other task force members that have questions? Kim, or let me ask this: is there any special, attention given to those families that are in rural Indiana? Because we know that there is a lack of services, there's a lack of providers, there's a lack of workers in rural Indiana. Do we have any kind of a strategy to work with those families that live in rural Indiana?
Lieutenant Governor, I would say to that as a whole, even, prior to the Medicaid forecast, highlighting the most recent issue, we've been aware of those matters in our rural areas. And as you know, Peggy Welch, our Chief Advocacy Officer, has been leading an FSSA-wide initiative on the Direct Service Workforce Initiative. So we've really been honing in on how do we address this, not only through bringing in a larger pool of qualified direct service workers, but how might we address this through other strategies to better support needs? So yes, I mean, as a whole, I think we have known that's been a part of our efforts in looking at waiver redesign and waiver reset, if you will. And I think in particular, I stress the importance of those care managers and case managers. It really is looking at these, to your point, as you talked about, meeting individuals and families, looking at it in individual cases and trying to build the best support around that individual and their family, inclusive of home and community-based support, but those other systems and resources that I referenced as well.
Right, but they aren't there.
Right, I
The
think
resources aren't there. That's the problem. I think Senator Yoder, you have a question?
I would just, to connect to the dots a little bit, the other thing that we're trying to do here is stage the ability for, like Kelly said, for families to continue to do this. So they may be able to continue to do that if they're in a rural area, if they're in an urban area. I think one of the things that we are trying to stage for folks over the course of the next few months is an on-ramp for structured family caregiving, but also signaling to people, if you want to become a structured family care provider and you don't do that today, and this would allow your parent that's getting paid to provide that care, an attendant care today, to be able to continue to do that under structured family care. We want to be able to provide a pathway for people to be able to do that. So in that sense, we are trying to create some pathways for folks to do some things in a seamless way that hopefully won't create a
Thank
real
you.
issue in
Thank you.
terms of access to services,
Right.
but be
Kelly,
able to
you've already,
offer
yes, thank you.
maybe
Kelly. I
an
didn't
expedited
interrupt.
path or another path that we're still
So
kind of
we have,
exploring to
we have a
ensure that
question
we have a
from
provider,
Senator
adequate
Yoder.
provider
Can you
capacity
hear me?
space for
Excuse
this
me.
transition in particular.
Can you hear me? We have a
Yes,
question
we
by
can.
Just making
Senator
you guys
Yoder.
aware that's a
Please.
path we're trying to take too.
Thank you. We have a question by Senator Yoder.
I wanted to reiterate what Representative Claire is asking. I think that would be really helpful. But can you speak to where families will be if they didn't have prior authorization to the January 17th date? What will happen with those individuals and families before the July 1st change, or what we're discussing right now? Where are they?
I am really sorry. I missed the first part of the question. Would you repeat that?
My question is, for families and individuals who had authorization prior to January 17th, what happens to those individuals and families between now and July 1st?
Okay, families that are currently providing attendant care as an LRI, that legally responsible individual, if they were doing that on an approved plan prior to January 17th, they may continue to do so through June the 30th. And so what we're talking about is they can continue to do that and plan for transition and work with their team, so that they are not being abruptly ended from access to that lane of service and support. We did not want to disrupt their lives. And so giving that on-ramp from now to July 1, they can continue to provide it and plan for that transition to structured family care or other alternatives, whatever they would choose to do.
Right,
All right.
but I'm asking about the families who didn't have prior authorization or weren't on the program before January 17th. Where are they in this process?
They would. Okay, I'm going to let Kathy wants to answer that one, and I'm going to let her.
Yeah, so we have a couple of I guess scenarios to be thinking about. Kelly just talked about those people who are already approved. They have already been provided or have been approved to provide attendant care as an LRI. What we've said is, because this service is not currently approved in the waiver to allow for that to occur, we need to essentially stop the practice until we can get another mechanism in place. Those individuals should definitely connect with their care manager in terms of what service options are available that might potentially meet their needs. They may be able to receive attendant care from other family members, because this is a space where the restriction is particularly to those legally responsible individuals. There may be other family members or other known people that would be willing to provide that attendant care in the interim, or there may be other service options that can meet their needs. But that would probably need to be looked at on a case-by-case basis to really understand what the specific service need for those individuals coming through the door would look like, and whether or not any of those existing options could be available for them.
I'd like to follow up on that, Lieutenant Governor, if I may.
Yes, and then let's make this the last comment, and then we'll have closing comments by any of the task force members, and then we'll have to, and
Thank
please,
you. So-
Representative Clear.
Ms. Robinson, following up on what you just said, can FSSA guarantee that every family that needs services will receive services without delay?
I think to the sorry, we're having some technical issues. I think to the extent that we can appropriately get teams to meet with individuals and families and talk through what their individual needs are. I think there's always a challenge with service access. You guys just talked about that a little bit ago in terms of availability of staff or availability of services, depending on where you are. So I can't guarantee 100% that everybody's going to go with every single service that they would like to have. I think what we need to look at is actually the true need of the individual that we're talking about, and not necessarily kind of the broader scope of the family dynamic and what makes the most sense for that individual in terms of service array. Now, that may mean people need to do things differently than what they're doing today. That may mean submitting a prior auth request for PA services versus what they normally would have just had the waiver holistically provide to them, or accessing some of the services that Kelly mentioned earlier to better fully utilize other supports and services that maybe are not specific to the waiver.
All right. And Representative Clear, you had mentioned that Sean, this will truly be our last statement. Do you want
Yes.
to?
I know we're at time. What I have up on the screen, just for reference, I know we've
yes.
shared
Let
this.
me
but
I
read.
understand
Just
we're at Kelly. I
reminding
understand
folks,
we're at time.
if you have
Yeah, Ms.
general
Mitchell.
comments or inquiries.
Ms. Mitchell, I'm going to
Excuse me.
read. Ms. Mitchell, I'm
continue
going
to
to
send
read.
those
Ms. Mitchell, Ms. Mitchell, I have the floor, please.
to Medicaid.
Ms.
Representative
Mitchell.
Clear.
I'm sorry, my
Mitchell.
speaker was down. Yes.
Yeah, I have the floor. I'm going to read a comment from Sean Fulton, who is a self-advocate. He posted in the chat. I want to know what is going to happen to the families. What is going to happen to let families know that they are only getting a per diem and not getting regular pay, and how are they going to live and take care of their families? That's from Sean Fulton.
I think as Kathy noted, as I noted, individuals that are currently providing as an LRI will be receiving notice. They'll be working directly with their care manager and case managers in one-on-one situations. And we are working on some additional guidance regarding transitioning to structured family care. So, and my apologies, Rep. Claire, I had my speaker muted and I did not hear you speaking.
Yeah. All right. Let me just finish up. What I just heard is we're working on additional clarifications. I've heard we're trying to get information. I've heard we're going to adjust. I've heard no data. I've heard we're working on. At this point in time, until these questions can be answered, I would call upon FSSA to pause in their timetable for the implementation of this program by July 1. And I would call upon the General Assembly to be supportive and to look at how they can make that happen. Representative Clear.
Yes, Lieutenant Governor, I hear you.
Any comments from you or anyone else?
No, I agree completely with what you just said. I think there's too little information and too little transparency, and as a result, FSSA should pause until there's transparency and adequate information for families and other stakeholders. So I appreciate your leadership on that.
Any
And
other
I join you in that, Representative Claire. On the
Thank you,
Senate side.
Senator. Any other comments by task force members?
This is Kim. Thank you for the recommendation. We're behind you 100%.
Thank you.
This State Representative Chris Campbell. I also agree, and I think that our state budget should look at our funding before approving additional millions of dollars to things like the IEDC and expanding the voucher program and things like that when we have not adequately addressed our responsibility to these families. Thank you.
Anyone else? You know, we're going to be judged by how we care for the most vulnerable among us. Let's be judged in a positive way, in a positive manner. So thank you all for participating. And thank you, FSSA, for your information. Take care.
Thank you. We'll be sending the slide deck momentarily to the members.
And we will be sending out the conversation from the chat room. Thank you all.
All right. Thank you.